I'm Dr. Randel Smith. I'm one of the interventional cardiologists at Portneuf Medical Center. And as part of Heart Month today, what I'd like to discuss is blood pressure and specifically hypertension or elevated blood pressure. So when somebody takes your blood pressure, typically they tell you two numbers. There's a top number that is referred to as systole and the bottom number that we refer to as diastole. It's very simple in that the top number is the pressure generated when your heart squeezes, and the bottom number is the pressure that remains while your heart is relaxing. So those are the two numbers that you get when somebody takes your blood pressure. With regard to hypertension, specifically, what is that? And that is high blood pressure. So a normal blood pressure is typically, we characterize that as where the top number or the systolic blood pressure is less than 130 and the diastolic or the bottom number is less than 80. When you have high blood pressure, we divide it into two stages. Stage 1 is top number being 130 to 139 and the bottom number being 80 to 89. The stage 2 hypertension or more significant hypertension is when the top number or systolic blood pressure is over 140 and the diastolic blood pressure is over 90. Hypertension is extremely common across the country, and it's said that up to 50% of the adult population will develop hypertension during their adult lives. Unfortunately, around 80% of these folks never get their blood pressure well controlled. Also, many are started on medications, and it's uncommon that more than about 50% actually stay on the medications because of side effects, medication costs, or other issues. So the big thing is, why is this important? Why do we check it? Why do we need to continue to follow up with it? And the short answer is that long-standing high blood pressure can lead to bad cardiovascular outcomes. It markedly increases your risk of coronary artery disease or acute heart attacks. It increases your risk of heart failure. It increases your risk of stroke, as well as chronic kidney disease and even end-stage renal disease. So while high blood pressure many times causes no symptoms, it's sometimes referred to as the silent killer. High blood pressure that's untreated or unabated over many years leads to markedly decreased lifespan. And it's said that for every 20 millimeters of mercury that your blood pressure is high, that doubles your risk of death from cardiovascular disease. So, what exactly and how do we make the diagnosis? We've talked about stage 1 and stage 2, but it's also important to discuss that one elevated blood pressure reading does not necessarily mean that you have high blood pressure. Many factors can affect a single reading, including anxiety, stress, high salt diet, alcohol consumption, different medicines like non-steroidal anti-inflammatory drugs, i.e. ibuprofen, Motrin. So many things can affect what your blood pressure readings are. Typically, we say somebody has a diagnosis of hypertension when they have multiple readings in an office setting of greater than 140 over 90. Many times we'll recommend home blood pressure monitoring, and what we find is that sometimes folks have much lower readings at home. It is real important to also discuss the way to take your blood pressure. and that is you should be sitting down in a chair. You should be relaxed. You should say nothing, no talking, no interactions with other folks for 5 minutes. You should have an empty bladder, and the arm should be right around the bicep at about the mid-arm or the mid-chest. It's also important to discuss that you need to make sure that you have the appropriate blood pressure cuff size, because in folks that have big arms, that can lead to falsely elevated readings. So be sure that you check, and be sure there'll be ways to measure it when you check your blood pressure at home. One of the reasons also for checking the blood pressure at home is to determine if you have what we refer to as white coat hypertension, and that is elevated blood pressure readings while you're at the doctor's office, but normal blood pressure readings at home. That's important because that's not something that needs to be treated and not necessarily associated with a bad long-term prognosis. So who tends to get blood pressure elevations or high blood pressure? You have increased risk as you age. Your arteries get stiffer and less compliant. Visualize that as kind of turning in from a rubber hose to a lead pipe, and that tends to lead to increased blood pressure readings. Obesity, family history, race is also associated with more frequent high blood pressure, specifically African Americans. Diet, physical inactivity, sleep abnormalities, either too little of sleep or obstructive sleep apnea, as well as excessive alcohol. It's important to note that we recommend for men less than 2 drinks of alcohol per day and women less than 1 drink per day. So the big thing is, who needs to be treated? Typically what we say in folks with stage 1 high blood pressure or hypertension, where the blood pressure is 130 to 139 over 80 to 89, we tend to do what we call lifestyle modifications, and that is a healthy diet that's low in salt, high in potassium. Typically that's going to be fruits, vegetables. We try to avoid red meats. We also recommend weight loss, reduction of any alcohol consumed, and then one of the big ways to reduce your blood pressure is exercise. Typically what we recommend is 30 minutes a day of aerobic training up to 5 days a week, and then 30 minutes a day of resistance training up to 5 minutes or 5 days a week. So resistance training can be weightlifting, but also can be yoga. Anything that uses resistance and your body weight is helpful from that standpoint. With regard to medicines, who needs to be treated with medicines is very important. Again, typically we don't have or take one blood pressure reading to make the diagnosis of hypertension. It's multiple readings over 140, over 90. And if you have that, then we tend to say this patient needs medicines. It's also important to know that medications for blood pressure, while they are effective, they're not highly effective. And one medication typically will only reduce the blood pressure by about 15 millimeters of mercury. So if you need a 20 millimeter of mercury reduction, it's not uncommon that your doctor will start you on 2 blood pressure medicines at one time. And typically it takes 2 to 3 medicines to control hypertension. It is important though, because if we can reduce your systolic blood pressure by just 10 millimeters of mercury, then we reduce the risk of cardiac events and vascular events by about 20%. So reducing your blood pressure long term can markedly reduce your risk of stroke, heart attack, death, heart failure, and kidney disease. A couple of other things that we probably should talk about is, when should you really get worried about your blood pressure? When should you discuss with your primary physician, do I need a hypertension specialist? And typically what we would say on that is somebody who has onset of high blood pressure at less than 30 years of age, when they don't have a family history. Other folks that we would worry about that may need additional testing is if your blood pressure has been well controlled on medicines, and then all of a sudden it starts going up and getting very high, such as 160 over 100, 170 over 110. Those are certainly patients that would need some additional testing and probably benefit from somebody who has a special interest in hypertension. So obstructive sleep apnea is another area that is not always realized is associated with very difficult to control hypertension. And lastly, what I'd like to briefly discuss is new treatments for hypertension. There has been a new treatment approved just in the last several months, and that is a procedure called renal denervation. And the physiology behind renal denervation is that what we've discovered over the years that there are very small plexi or little groups of nerve fibers that run around the kidney and along the aorta. That's the major artery that's on the inside of your abdomen. And these little clusters or nerves in certain folks become hyperactive, and they have input to the kidneys, the brain, the heart that cause certain mechanisms to increase blood pressure. And many times this blood pressure can be really hard to control. So the new procedure is the procedure called renal denervation. And basically what we do is go in from the leg or groin with a catheter, and we put a catheter on the inside of the kidney arteries, and we apply some heat energy to the tissues around the arteries. And what we found is that we can reduce the systolic blood pressure by around 10 millimeters of mercury without medications. It's not necessarily a cure for hypertension, but it actually can be quite a additional mechanism in conjunction with medicine to help with better blood pressure control. And even in some of the registries, we're now seeing that this type of procedure can result in up to 17 millimeters of mercury reduction. And the good news is it's a long-term reduction that holds up at 3 to even 5 years. So if you've had blood pressure that has been uncontrolled despite 3 or 4 different medications, see your primary physician, ask them about renal denervation. It is something that we will be offering here at Portneuf Medical Center. Thanks a whole lot. Hopefully you found this beneficial and educational, and remember, we're here to help. Thank you.